everyone, so let's move towards our today's topic, which is anterior abdominal wall. So as we have already we know that abdomen is the region which is present below the thorax, and thoracic region के नीचे abdominal region होता है below diaphragm, and from xiphoid process till or from the costal margin till the hip bone. This area is present in the stomach, esophagus, duodenum, small intestine, large intestine, liver, pancreas, kidney are present, spleen is present, and many other organs are present. So what happened? These organs are present inside the abdomen, but the point is you have to know that around the surrounding these that what are the things which are forming this abdominal wall. So the first thing is skin, which you can easily see. It is present and you can see with your eyes, okay, easily. Below skin, deep to the skin, fascia is present. That fascia is divided into two layers: superficial fatty layer and membranous layer, okay, and we will discuss after few minutes. But the point is that first of all, skin is present. Below skin, fascia is present. Below fascia, deep to the fascia, muscles and the rectus sheath is present. Now after muscles and after the rectus sheath, fascia transveralis is present. Now we will discuss about the rectus sheath and the fascia transveralis in the in separate lecture, but you have to remember these points as well. And after fascia transveralis, peritoneum is present, and that then after peritoneum, inside the peritoneum there are the foldings of peritoneum which are connected with the organs which are present inside the peritoneum, okay. Peritoneum is present, which is forming the cavity inside the abdomen, and in that abdomen, liver, stomach, esophagus, duodenum, and many other organs are present. Now first of all, skin is very simple, and you have to know that skin is present, and on skin on the anterior abdominal wall in the midline there is a scar. We have studied that umbilicus, and and you can watch that lecture separately because I have recorded that lecture about umbilicus in a separate I have discussed that topic of umbilicus in a separate lecture. Now in this lecture we will gonna talk about particularly about fascia, okay. Now subcutaneous tissue, like I said, it is present below the skin. Now subcutaneous tissue are divided into two layers: superficial fatty layer, which is also called as Camper's fascia, and below that membranous layer, deep membranous layer is present, which is called as fascia Scarpa's fascia, okay. Now the point which is very important regarding the membranous layer is that membranous layer is continuous with the perineum. Now what is perineum? Perineum is basically the area around the male reproductive organ, the area near the pubic symphysis is called as perineum. So in that area, that membranous layer, which is the layer of the subcutaneous tissue of the anterior abdominal wall, that will be continuous in the perineum area, and they will form a thickened membranous area, and that is called as Coulé's fascia, okay. They will become thickened, and that thickened layer is called as Coulé's fascia, which will form a ligament as well, okay. So you have to remember that Coulé's fascia is present near the pubic symphysis area and the perineum area, okay. In the perineum area, Coulé's fascia is present, and how Coulé's fascia is formed? It is basically the continuation of the deep membranous layer, which is the layer of the subcutaneous tissue of the anterior abdominal wall. Now like I said, after skin, deep to the skin, fascia is present. Then after fascia, muscles are present. So in this lecture we will also gonna talk about the muscle, and it's very simple, very easy to memorize. If you are listening this lecture, if you are watching this lecture, it's very easy to memorize it. If you are watching this lecture, I am repeating again, if you are watching this lecture, it's very easy to memorize it. How? Now these muscles, like I said, these muscles are 4 in number, and they are forming anterior abdominal wall. Now it helps in movement of the trunk. What are the functions of these muscles? It help in the movement of trunk, it help in sneezing, shouting, coughing. Okay, so during these things, these abdominal muscle, these these muscles which are present in the anterior abdominal wall are very much important. They are four in number. Number one, external oblique muscle. Number two, internal oblique muscle. Number three, transversus abdominus. And the last one is rectus abdominus. Okay, now these all four muscles are supplied by thoracic nerve T7 till T12. Okay, T7 till T12, the nerve supply is same in all the muscles, so it is very easy to memorize के T7 till T12 जो nerves हैं वो supply करेंगी in muscles को. Now we will also discuss the nerve supply of the anterior abdominal wall in a separate lecture, but for that, for the muscles, you can easily memorize that these all muscles are supplied by T7 till T12 nerve. Okay, now there are four muscles. First we will gonna talk about external oblique muscle. Now before starting the muscle, how to memorize it, I will tell you in that manner which is very much easy for you to memorize this topic, as well as it will help you to understand this topic. Now before starting this topic, you have to remember that these abdominal muscles are connecting the ribs. These are present between the ribs and the hip bone, because in this area abdomen is present, and the wall which is present between this area is called as anterior abdominal wall, and the muscles which are present in this anterior abdominal wall is basically these four muscles. Okay, now the last point before starting this topic is linea alba. Now linea alba is the fibrous structure which is present in the midline of the abdomen from the xiphoid process, from the tip of the xiphoid process till pubic symphysis. What is pubic symphysis? The right and the left hip bone are joining together anteriorly, and that form pubic symphysis. So the line which is joining, you can say, you will easily see in those people who used to go gym, and the people जिनके पास बॉडी है, बॉडी बनाते हैं, जिम जाते हैं, तो उनके सेंटर में, उनके मिड लाइन पे एक लाइन आपको नज़र आएगी, एंड दैट इज़ बेसिकली लीनिया एल्बा, विच ऑल्सो which is also crossing the umbilicus as well, because umbilicus is the scar which is present in the midline. Okay, so between the xiphoid process and the pubic symphysis, the line is called as linea alba. This linea alba is basically formed by the attachment of all the anterior abdominal muscle. Okay, how? These all muscle, remember this sentence, these all muscles of anterior abdominal wall will insert, you have to remember the insertion. So these insertions are, they insert in the linea alba, xiphoid process and pubic bone. Remember this point, all these muscles are inserted in the pubic bone, are inserted to the pubic bone, xiphoid process and linea alba. Okay, if you remember this, the insertion now is very easy. First of all, the outermost, the superficial muscle, the most outer muscle is external oblique muscle, which is just below the superficial fascia. Which is just below the deep membranous fascia. Like I said, skin होती है, skin के बाद superficial fascia, fatty layer, and then deep membranous layer, and then जो muscle होगा वो होगा external oblique muscle. External oblique muscle, deep to the external oblique muscle, internal oblique muscle is present, and after internal oblique muscle, transversus abdominus is present. Okay, like we have studied in the ribs, that external intercostal muscle, internal intercostal muscle, then innermost intercostal muscle. Same like that, there are these three muscles are present, and outermost, like I said, external oblique muscle is present. Now external oblique muscle will also form, like I said, the insertion is very easy. So how it will originate? It will originate from the ribs. Okay, it will originate from the last 8 ribs. ओके, रिब से सेरेटस एंटीरियर मसल भी अराइज होते हैं और मसल्स भी ओरिजिनेट होते हैं, कुछ इंसर्ट होते हैं, बट सेम लाइक दैट एक्सटर्नल ऑब्लिक मसल विल ओरिजिनेट फ्रॉम द last eight ribs, and they will insert into the xiphoid process. Like I said, the insertion is same in every muscle. Then it will insert into the linea alba as well, and then pubic symphysis as well. Now nerve supply, you know, so basically for each muscle you have to know what is the nerve supply, what is the origin, insertion, and other features as well. So nerve supply, like I said, all the nerves, all the muscles of the anterior abdominal wall are supplied by T6 T7 till T12. Okay, and the insertion is same in all the muscles. Now you have to remember some other features, and in some cases you have to remember the origin as well. Now external oblique muscle is arising from the rib cage, but the internal oblique muscle is arising from the hip bone. Okay, so if it is arising from the hip bone, so the insertion will be changed in this muscle. Internal oblique muscle is an exceptional case that the origin is from the hip bone, which is iliac crest and the inguinal ligament, and then it will insert into the rib cage. Okay, last four costal cartilage or last four ribs. Okay, now the third muscle is transversus abdominis. Okay, before that the internal oblique muscle will also insert into the linea alba as well. ओके, लीनिया एल्बा में इंसर्ट होंगे, जीफाइड प्रोसेस में इंसर्ट होंगे, लेकिन सिर्फ और सिर्फ फ़र्क क्या है, प्यूबिक बोन का, ठीक है, हिप बोन का, हिप बोन की जगह वो रिब्स में जाके इंसर्ट होंगे क्योंकि हिप बोन से तो वराइज हो रहे हैं. नाउ फर्दर ट्रांसवर्सस एब्डोमिनस, so it is present below deep to the internal oblique muscle, and its origin is internal inguinal ligament and iliac crest, which is very easy, hip bone से arise होंगे, and then it will insert into the linea alba, pubic crest, xiphoid process. Okay, and the last muscle which is forming the anterior abdominal wall is rectus abdominus, which is originating from the pubic crest, pubic ligament, and then it will insert into the costal margin and the xiphoid process. So basically from the from superior to inferior, the muscle which is moving, which is running, the fibers of the muscle which are running from superior to inferior, that is basically external oblique muscle. Okay, but लाइक आई सेड के ओरिजिन कहाँ से होंगे, एक्सटर्नल ऑब्लिक मसल रिब केज से, लास्ट 8 रिब से, और इंसर्ट कहाँ होंगे, लीनिया एल्बा, ज़ीफॉइड प्रोसेस और प्यूबिक क्रेस्ट पे. जबकि इंसर्ट बाकी जो मसल्स हैं, इंटरनल ऑब्लिक मसल, ट्रांसवर्सस एब्डोमिनस, रेक्टस एब्डोमिनस, सो दे विल ओरिजिनेट फ्रॉम द इलियक क्रेस्ट, इंग्विनल लिगामेंट, एंड इफ आई टॉक अबाउट रेक्टस एब्डोमिनस, so it will originate from pubic crest, pubic ligament as well. Okay, the insertion is same in all the muscles. It's very easy to memorize it. So this was the whole topic regarding this muscle, the muscles of the anterior abdominal wall. One thing which is very much important regarding external oblique muscle, and it's very important regarding exam point of view as well, that the external oblique muscle external oblique muscle between the anterior superior iliac spine and the pubic tubercle. Okay, as you know, the regions in the hip bone, there we have discussed the two parts in the hip bone lecture, that there is anterior superior iliac spine and the pubic tubercle. So between that there is a ligament, and that ligament is formed by external oblique muscle, and that ligament is called as inguinal ligament. Okay, which is very 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 important, because on that inguinal ligament spermatic cord is also present. What is spermatic cord? Spermatic cord is basically the reproductive organ of male. Okay, so and in female the thing which is present, the organ which is present, that is round ligament. Okay, so spermatic cord in men and round ligament in women. Same like that, superficial inguinal ring. Now what is superficial inguinal ring? Near the pubic symphysis, near the pubic crest, pubic tubercle and pubic symphysis, the external oblique muscle is hollow, triangular hollow structure, hole is present, triangular hole is present, and that is called as superficial inguinal ring. And on that ring, in that hollow like structure, spermatic cord and round ligament is present. Round ligament in women and spermatic cord in man. Okay, and if I talk about inguinal ligament, so it's different. Inguinal ligament is for the spermatic cord in the man. Okay, if I talk about man's, so a gentleman, so in man the spermatic cord is present on the inguinal ligament. Okay, and if I talk about superficial inguinal ring, so superficial inguinal ring में pubic crest होती है, जो pubic crest के near होता है, करीब होता है, और spermatic cord होता है अगर हम मेल की बात करें, और अगर फीमेल की बात करें तो राउंड लिगामेंट होती है. Okay, so one thing I forgot to tell you is about rectus abdominis muscle. Like I said, there are 4 muscles: external oblique muscle, internal oblique muscle, and transverse abdominis muscle, and rectus abdominis muscle. Now what is rectus abdominis muscle? Rectus abdominis muscle is the only vertical muscle present in the anterior abdominal wall. Okay, and it is a vertical muscle which is present on each side of the linea alba. Like I said, linea alba is the fibrous structure present in the midline, which is present between the xiphoid process and the pubic symphysis. So on each side of the linea alba, rectus femoris muscle is present, और rectus femoris muscle ही होते हैं जिसकी वजह से वो बॉडी और वो जो 6 पैक्स बनते हैं ना, वो बेसिकली इसी की वजह से बनते हैं. ठीक है. So this muscle is basically vertical muscle, and medially it is attached with the linea alba. Laterally, the tendons of the rectus abdominis muscle will form a tendinous line, and that is called as linea semilunaris. Okay, so this was the whole topic regarding the muscles of the anterior abdominal wall. The blood supply and the nerve supply are in the separate lecture. Till then, work hard, study hard, and good luck. Take care. Bye bye.